Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. My name is Nur Masturina binti Fazil Osman, and here with me is Nurul Syafiqah binti Yusrifa, and my other team members are Nurul Ain Fahana, Haizatul Umiyah, and Nur Akila. So today we will be presenting on diabetes mellitus. And our presentation will be based on a few topics, which are firstly, the introduction about diabetes mellitus. Secondly, the types of diabetes mellitus, which is also in the introduction. Thirdly, the pathophysiology of diabetes mellitus, the treatment of diabetes mellitus, awareness, and also we will conclude this presentation. So what is diabetes mellitus? Diabetes mellitus is a type of disorder when the blood glucose level is abnormally high or hyperglycemia, and this is due to inadequate production of insulin, or the body does not respond well towards the insulin or insulin resistance. So hyperglycemia is a metabolic disorder of carbohydrates, as sugar is one of the carbohydrates apart from starch and fibers. There are several symptoms of diabetes mellitus, which are um, excessive thirst and hunger, or polyphagia and polydipsia, and increase in urination or polyuria. So there are a few types of diabetes mellitus. Firstly, type 1 diabetes mellitus. It is an autoimmune disease, and it is formally called as insulin-dependent diabetes. And type 2 diabetes mellitus, which is formerly known as non-insulin dependent diabetes mellitus, and it is the most common type of diabetes mellitus. And thirdly is gestational diabetes mellitus, which is only happen during pregnancy and goes away after pregnancy. So during pregnancy, placenta produces a hormone that increases insulin resistance. Other specific types of diabetes mellitus are genetic defects of beta cells function, genetic defects of insulin action, pancreatic, exocrine, and endocrine disease, and many more. So now we will look into what is the pathophysiology of diabetes mellitus. Diabetes mellitus, the type 1 diabetes mellitus occurs due to lymphocytic infiltration, which destructs the insulin-secreting beta cells of the islets of Langerhans in the pancreas, which naturally is important in secreting insulin. So as beta cell mass declines, insulin secretion decreases until there is no available insulin to bind to the insulin receptor. Hence, when this happens, the glucose transporters such as GLUT4 cannot translocate to muscle cells and fat cells, which is adipocytes. Therefore, glucose in circulation cannot be transported to liver nor uptake by these cells. This leads to high blood glucose level and causes the symptoms I mentioned, such as polyuria, polydipsia, polyphagia, and also weight loss. At the same time, the low level of insulin decreases the suppression of glucagon, causing the elevated levels of glucagon. When this happens, glycolysis is inhibited, glycogenolysis, lipolysis, gluconeogenesis is on the other hand stimulated. And another causes of another results of low insulin is that it accelerates the metabolism of amino acids and fatty acids. As for type 2 diabetes mellitus, it is due to insulin resistance, whereby even though insulin secretion is normal or elevated to compensate for high blood glucose levels, the cells are resistant to insulin and it cannot lower the blood glucose level. Type 2 diabetes mellitus also may occur from formation of pancreatic islet amyloid deposits, which will contribute to beta cells dysfunction. So these islet amyloid deposits occur because when insulin resistance happen, the beta cells of the Langerhans islands will either become hypertrophy to secrete more insulin. When this happens, at the same time, the islet amyloid deposit also increases, causing aggregation of islet amyloids and contributes to beta cells dysfunction. So next, we will look the treatment for diabetes mellitus, and I will pass this to Nurul. Thank you, Sister Masturina. Now, I will present about the treatment for diabetes mellitus. Okay, for type 1 diabetes mellitus, as mentioned previously, it is an autoimmune disease in which the patient is unable to produce insulin. There is no other solution or alternative but by using insulin. Patients may need tight communication and interaction with certain people for the treatment process, which include the physician, nurses, dietitians, and psychologists. Not only that, the presence of family is also important for moral support and supervision at home to ensure that the insulin or medication is taken at the right time and in an adequate amount. A great planning and abidance towards the insulin intake may facilitate the patient to promote healthy lifestyle, also to control and prevent the patient from facing severe hypoglycemic, commonly occur among patients with type 1 diabetes mellitus. Commonly, insulin can be taken by using an insulin pen and also insulin pump. However, ultra-rapid inhaled insulin is also available. Next, for the treatment for type 2 diabetes mellitus, the most common target treatment for type 2 diabetes mellitus is through weight loss. Practicing a healthy diet with low in saturated fat, refined carbohydrates, high fructose, corn syrup, and high in fiber, and monounsaturated fat is essential and very encouraged by the physicians. In addition, having aerobic exercise for 90 to 150 minutes per week can be beneficial to promote metabolism and weight loss. However, in some cases, the patient is unable to maintain the level of blood sugar through diet and physical exercise. Actually, there are few options, which are patient may take metformin such as Fortamet and also Glumetza as the first line therapy. It can lower the glucose production in the liver and also improve body sensitivity towards insulin. Also, patient may take oral sulfonylureas to boost the secretion of insulin. Okay, next, the treatment for gestational diabetes that occur among pregnant women. Physicians would usually suggest the patient to start with diet modification, practice regular exercise, and do glucose monitoring. For a better knowledge among pregnant mothers, it is essential to get a nutritional counseling by registered dietitian. Next is exercise. It is recommended to work out 30 minutes of moderate intensity aerobic exercise at least 5 days a week or minimum of 150 minutes a week. However, certain patients may not have an adequate glycemic control. Is not adequate according to the diet and exercise. Hence, the patient may take another option that are recommended to begin with pharmacologic treatment. Firstly, insulin uptake as the first line treatment. Next, patient can also take metformin by begin with 500 mg and the maximum dose of 2,500 mg. Next, patients can also take glyburide to begin with 2.5 mg and the maximum dose of 20 mg. Okay, now let's take a look on the awareness on diabetes mellitus. First of all, people need to acknowledge the risk factor for type 1 diabetes. Family history is a great identifier to a lot of disease, such as having a parent, brother, or sister with type 1 diabetes mellitus. Next, age. People can get type 1 diabetes at any age, but it is more likely to develop type 1 diabetes mellitus during childhood, teen, or young adult. Now, risk factors for type 2 diabetes, which are have pre-diabetes, being overweight, in the age of 45 years old and older, have a parent, brother or sister with type 2 diabetes, and then if the patient are physically active less than 3 times a week, also if the patient have history of having gestational diabetes during pregnancy or given birth to a baby who weigh more than 9 pounds, or we can also call 4 kilograms. And the last risk factor is the family history. If the patients have siblings or parents with type 1 diabetes mellitus. Okay, now let's take a look with risk factor for gestational diabetes, which are the parents, the patient is overweight, had given birth to a baby who weighed more than 9 pounds or 4 kilograms, and the patient have had gestational diabetes during the previous pregnancy, and also about the native of the patient, which are African American, Latino American, Alaska Native, American Indian, Native Hawaiian, or Pacific Islander also. And about the age, people who age 25 years old and older are at risk to have gestational diabetes. And then, again, the family history of type 2 diabetes play a big role. And also about the hormone disorder called polycystic ovary syndrome may cause one person to have gestational diabetes. Last but not least, the Islamic perspective and the conclusion for this topic. While type 1 diabetes mellitus cannot be prevented as it is an autoimmune disease, the risk of getting type 2 diabetes mellitus can be reduced by practicing a healthy lifestyle, such as healthy diet, exercise, weight loss, and to control of other modifiable risk factors such as sleep and stress. Here, eating habit is one of the modifiable risk factors that can be controlled to lower the risk of having diabetes mellitus. In Islam, people are encouraged to eat healthy and nutritious food besides eating food in a moderate amount, as mentioned in the Quranic verse, mentioned, eat and drink but not too extravagant, in Surah Al-A'raf, verse 31, which means that we shall eat and drink in a moderate manner that satisfy the need of the body for energy and nutrition. Here it is highlighted that Islam encouraged us to stop eating before full. Another related verse is, men, do not cast yourself into destruction by your own hands, in Surah Al-Baqarah, verse 195, which stress on responsibility as human beings who are granted by Allah with healthy body, need to maintain healthy body and avoid any illness or harm. In conclusion, maintaining a healthy lifestyle should begin from younger age to prevent any risk in the future, such as family diabetes mellitus that are common among Malaysians. Therefore, identify the family history, practice physical activities, and control dietary intake are important to be taken care of in daily life for a better health and future. I think that's all from our group presentation. Thank you.